If you've already celebrated your 60th birthday and your doctor recently gave you a pat on the back because you finally hit that 120/80 mark, what I'm about to tell you might completely change your perspective on your health. A deep dive analysis published in the prestigious Journal of the American Medical Association, JAMA, which followed 15,000 seniors over a 5-year period, yielded conclusions that directly challenge the long-standing dogmas about ideal blood pressure levels. It turns out that those older adults who boasted textbook numbers, that supposedly perfect 120, faced a 28% increase in the likelihood of suffering a traumatic fall. Even more alarming, their survival rates were actually lower compared to those who maintained slightly higher readings. I'm Dr. Elena Ross, and the information I'm going to break down in the next few minutes has the real potential to protect your physical safety or that of your loved ones, starting right now. Before we dive in, I'd like to ask a simple favor to help personalize this experience. Go ahead and type just your age in the comment section right now. Nothing else, just the number. I need to know who is on the other side of the screen, because the recommendations I'm about to share vary significantly whether you are 65, 75, or 85 years old. Also, if you've ever felt like the world was tilting or experienced a head rush when standing up quickly, add the word dizzy to your message. This detail is vital for what I'll explain shortly, and you'll see exactly why in about 3 minutes. Let's imagine a situation that happens every day in thousands of clinics across the country. Think of a man named Arthur, a 79-year-old citizen coming in for his 6-month checkup. When his pressure is taken, the monitor reads 145/86. The healthcare provider, strictly following the general protocols on their screen, decides that number is too high for the under 130 standard and proceeds to adjust his medication. A new drug is added, and months later, the numbers triumphantly drop to 124/78. Arthur's chart records a clinical success, and he goes home feeling protected. However, there's an invisible factor that standard guidelines often overlook. That same night, Arthur gets up to go to the kitchen. As he stands, his blood pressure violently plummets in a matter of seconds, dropping from that ideal level to an abysmal 88/56. At that moment, the oxygen supply to his brain is momentarily cut off. The room starts spinning like a runaway carousel, and before he can grab onto anything, Arthur falls. At this point, we're no longer talking about blood pressure statistics. We're talking about a fractured hip, emergency surgery, and a long stint in rehab, which, unfortunately, is often the beginning of the end of one's personal independence. This gap between what the latest research shows and what is applied in daily practice is having real consequences on people's lives, and it's a gap most patients are completely unaware of. I know this might sound counterintuitive at first, so please stay with me, because this is where our perspective needs to do a 180-degree turn. For almost our entire adult lives, it's been burned into our brains that the lower the blood pressure, the better. For someone in their 40s or 50s, that premise is absolutely valid and necessary to prevent long-term heart or kidney issues. But human biology isn't static. Once you cross the 65-year mark, the rules of the game change. Scientific data shows that people in this stage of life who maintain a systolic pressure between 130 and 145 actually enjoy greater longevity. They have fewer hospital admissions, their bones are safer from fractures, and their mental faculties remain in better shape. On the other hand, the group that obsessed over reaching 100 20/80 suffered from more fainting spells, what we call syncope in medicine, and faced higher rates of acute kidney problems. For those of you who want to understand the biological why and not just follow orders, what I'm about to explain will give you a whole new mental map for caring for your body as you age. The engine of a 65-year-old car doesn't run the same way a 45-year-old one does. Your circulatory system isn't just a worn-out version of your younger self. It's a system that has adapted its internal engineering. There are 3 fundamental changes that happen over time that explain why we need different pressure targets. First, consider the loss of flexibility in blood vessels. Think of the difference between a brand new, highly flexible fitness band and one that's been sitting in a drawer for 30 years. The old band has become stiff and doesn't stretch easily anymore. Your arteries go through something similar. When the heart pumps blood into vessels that can no longer expand to cushion the flow, the system requires a slightly higher base pressure to ensure blood reaches the highest points of the body, like the brain, especially when we're standing up and fighting gravity. Second, we need to talk about our body's warning system, known as the baroreceptors. Imagine a smart thermostat in an old house that has gathered dust over the years. In a modern home, the thermostat detects a temperature change instantly and kicks on the heat. But in the old house, the sensor takes much longer to react. Our baroreceptors are those sensors. They detect changes in body position and tell the heart to beat faster or the vessels to constrict to stabilize pressure when we stand up. With age, these sensors get sluggish. If your pressure is already low and your sensors are slow to react, you're left vulnerable to a sudden drop in tension when you get vertical, resulting in those dangerous dizzy spells we mentioned earlier. The third pillar is how our bodies process chemicals. The kidneys and liver of a 65-year-old don't filter medications at the same speed they did 30 years ago. Therefore, a blood pressure dose that would be ideal for a young adult can be excessive and overwhelming for an older system, staying in the bloodstream longer and causing much more aggressive drops in pressure than intended. To understand the scale of what we're talking about, let's look closely at the internal medicine study I mentioned. They analyzed over 15,000 seniors with various profiles, some with diabetes, some heart disease survivors, and others with different levels of physical frailty. Researchers classified them into groups based on their systolic pressure. The results were eye-opening. The highest life expectancy and best overall health weren't found in those under 120, but in the group between 130 and 140, those with the lowest pressure didn't just have more kidney issues, their mortality rate was 14% higher. While it's true that those over 150 also faced significant stroke risks, the shocking discovery was that having pressure that is too low is just as risky as having it too high. There is a sweet spot, a middle ground, that actually guarantees a quality old age. Let's look at another common example. A gentleman named James, age 76, goes to his appointment and clocks in at 142/84. His doctor, worried about tradition and guidelines, insists on bringing that number down to 120. James starts a second medication and, sure enough, hits 122/76. The doctor celebrates, but James starts noticing that when he gets up from the dinner table, the floor feels like it's tilting for a second. When he mentions it, he's usually told it's just part of getting older. But what's really happening is that his perfect seated pressure becomes 95/60 when he stands. his brain is suffering micro episodes of poor blood flow every time he moves. This is entirely preventable if we understand that numbers should adapt to the person, not the other way around. Fortunately, there's a simple tool you can use today in the comfort of your own home to see if your pressure levels are putting you at risk. It doesn't require complex tech, just a standard home blood pressure monitor. It's called checking your orthostatic vital signs. Here's the procedure. First, lie down on your bed or sofa and stay completely relaxed for 5 minutes. Once that time has passed, take your pressure while still lying down and write down the 2 numbers. Immediately after, stand up and take the measurement again. Don't wait. If you notice your top number drops more than 20 points or your bottom number more than 10, you have orthostatic hypotension. This is a red flag indicating your medication might be too strong for your current biology. Even if your lying down pressure looks like a model's, that drop upon standing is what truly predicts the risk of a physical fall. So, what is the real goal we should be looking for? Let me give you some guidelines based on the latest science. Though always remember, this must be discussed with a professional who knows your specific case. For those between 65 and 74 who stay active, a range of 130 to 140 is usually ideal to protect the heart without compromising blood flow to the brain. If you're in the 75 to 84 bracket, the target moves up slightly to between 135 and 145, specifically to compensate for that vessel stiffness we talked about. And for those over 85 or individuals who already feel somewhat frail, a range of 140 to 150 might be the safest bet to prioritize stability and avoid fractures. As for the bottom number, the diastolic, the ideal for an older adult is that it doesn't drop below 65, preferably staying between 70 and 85 so the heart muscle gets enough nourishment during its rest phase. Let's look at a comparison to see how medicine should be personalized. We have 2 82-year-olds. On one hand, there's Dorothy, who lives alone, manages mild heart failure, and has some wear and tear in her joints from arthritis. Her pressure is 158/88. On the other hand, we have William, the same age, but he's still playing golf and has no other health issues. Even though they have the same number on the monitor, the approach with Dorothy must be much more cautious. Aggressively lowering her pressure could cause dizziness that leads to a catastrophic fall, given her bone frailty. For her, a level of 145 might be an absolute success and much safer than forcing a 130. It's about treating the whole human being, not just chasing a number on a screen. You might be wondering why your doctor hasn't mentioned this. The reality is that the healthcare system sometimes moves slower than the research. Many of the major studies that set the 120 standard were done with much younger people. Additionally, doctors are trained with the lower is better mindset, and changing that mentality takes time and a deep dive into each patient, something that is hard to achieve in a 15-minute appointment. To take charge of your health starting right now, I suggest these practical steps. Keep a blood pressure log for 2 weeks, checking it at the same time every morning and night. Make sure to perform the stand-up test I taught you and note any sharp drops. Most importantly, be honest with yourself about your symptoms. If you're feeling unusual fatigue or brain fog, don't just chalk it up to old age. It could actually be a sign of over-medication. With this data in hand, make an appointment with your doctor. Don't just listen, participate. Show your logs and ask what the specific range is for you, considering your personal history and not just general charts. Don't suffer through side effects in silence. Often, a small dosage adjustment can bring back your vitality and your confidence when walking. What you've learned today is knowledge that the vast majority of people simply don't have. You now know that for an older adult, 130 to 145 is the true safe harbor. You understand that a number that's too low can be a hidden enemy to your kidneys and your balance. You grasp the importance of the orthostatic test and why your body reacts differently to drugs today than it did 30 years ago, but above all, you now have the tools to be an informed and empowered patient, someone who actively collaborates in their own medical care. Please remember that this content is for educational purposes only. Managing your health is a serious matter that should be done alongside a qualified professional. Never make changes to your medication or treatment on your own based on this video. Use this information to enrich the dialogue with your healthcare provider and make joint decisions based on your full clinical profile. If this explanation brought you clarity and the confidence to take better care of yourself, I'd be honored if you wrote the word health in the comments. If you think this information could save a friend or family member, please share it with them. I invite you to subscribe, because my commitment is to keep translating complex science into useful tips that improve your quality of life. Your health is your greatest treasure, and it deserves protection. Don't let a silent oversight compromise your independence. If this video helped you, subscribe and share it. But pay attention. Stabilizing your pressure is just the start. There is a mistake lasting only 30 seconds that we make every morning which spikes the risk of a sudden heart attack. I invite you to watch the video on your screen right now. What you discover today could save your heart tomorrow. Don't ignore it.